The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video is useful for you, don't forget to like the video and subscribe to the channel for support. BENADRYL, which is in the class of antihistamine drugs. It is offered in tablet, capsule and liquid forms. The active ingredient of BENADRYL is diphenhydramine. What is BENADRYL and what is it used for? BENADRYL is a prescription medicine used to treat the symptoms of allergic reactions, insomnia, and motion sickness. How to use BENADRYL? If your doctor has prescribed this medication, take it as directed. Take the tablet, capsule, or liquid form by mouth with or without food. Measure liquid forms of this medication using a special measuring device spoon. Do not use a household spoon because you may not get the correct dose. The rapidly dissolving tablet or strip should be allowed to dissolve on the tongue and then swallowed, with or without water. The chewable tablet should be chewed thoroughly before being swallowed. The dosage is based on your age, medical condition, and response to treatment. To prevent motion sickness, take your dose 30 minutes before starting activities such as travel. To help you sleep, take your dose about 30 minutes before bedtime. If you continue to have difficulty sleeping for longer than 2 weeks, contact your doctor. Here are some things to know before using BENADRYL. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. These products do not cure or shorten the length of the common cold and may cause serious side effects. Before taking diphenhydramine, tell your doctor or pharmacist if you are allergic to it, or to dimenhydrinate, or if you have any other allergies. This drug may make you dizzy or drowsy or blur your vision. Do not drive, use machinery, or do anything that needs alertness or clear vision until you can do it safely. Liquid products, chewable tablets, or dissolving tablet strips may contain sugar and/or aspartame. Liquid products may also contain alcohol. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. This drug passes into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. BENADRYL side effects include drowsiness, dizziness, constipation, stomach upset, blurred vision, or dry mouth, nose, throat may occur.